Hi everybody, this is Carolyn, massage therapist. I want to do this video clip just to give you some information on what you're really asking for when you are asking for a deep tissue or deep pressure massage. This video is just to give you an idea of what you're really asking for, because when you come to us and you say, oh, I want a deep tissue massage or a deep pressure massage, what you're really asking for is that you want us to get down to bone level. And deep tissue, deep pressure massage is simply not meant for everybody simply because they ask for it. So what I'm going to go over is, what is deep tissue massage? What are the benefits? Who should get it? How does it work? Any precautions? And a discussion on the muscle layers and why you should not be so quick to ask for deep tissue or deep pressure massage. Now, I must also put in here my little disclaimer so nobody don't, come after me or anything. So the disclaimer is the information contained in this video is intended for educational purposes only and is not a substitute for advice, diagnosis, or treatment by a licensed physician. It is not meant to cover all possible precautions, drug interactions, circumstances, or adverse effects. You should seek prompt medical care for any health issues and consult your doctor before using alternative medicine or making change to your regimen. The pictures are credited to their source of origination. I am not the owner or the creator of the pictures. Now, having said the disclaimer, I would like to move on. So the first topic is, what is deep tissue massage? I'm going to tell you what it is, then I'm going to show you some pictures on what deep tissue massage look like. So deep tissue massage is a type of massage therapy. Deep tissue massage uses firm pressure with a slow stroke to reach deeper layers of muscle and fascia. Now, what does that mean? That simply means that before we go deep as massage therapists, we must warm the tissues first, wait for a release. When we feel the release, which means the tissues become to get softer and softer and softer, that let us know that we can move on to the next layer of tissue that we're trying to reach for whichever muscle tissue is the target tissue. Next is why deep tissue is used. Deep tissue is used for chronic aches and pain and contracted areas such as a stiff neck, upper back, low back pain, leg muscle tightness, and sore shoulders. Let's go with the back. I'm going to go with the back because most people who want deep tissue, if they don't want a full body deep tissue massage, they want deep pressure, deep tissue on their neck and their shoulders. The back muscles are very, very layered. Your muscles are 7 layers deep. I repeat, your muscles are 7 layers deep. Most of you don't know that. So what I'm going to go over is a little bit of information on the 7 layers. We as humans have 7 layers of fascia, meaning they're starting from the skin down to the bone because they're layered. Cells are grouped together in the body to form tissues, which is a collection of similar cells, and I'm going to show you a picture of what I'm talking about. A collection of similar cells that are grouped together to perform a specialized function. You have 4 primary tissue types in our bodies. You have epithelial tissue, connective tissue, muscle tissue, and nerve tissue. Now, I'm not going to go over what each of those are because then I will be giving you an anatomy lesson. That's not my purpose here. So I'm going to tell you, I'm going to name the 4. And if you're interested in what those 4 are, you can always reach out to me, and I will be glad to give you a full lesson on just what I'm talking about, but getting into more of the anatomy part. The next group of tissues after the nerve tissue, remember I said 7 layers, is your cardiac, your smooth, and your skeletal. That's going to give you 7 layers. Okay? Now, then I did promise that I was going to discuss the benefits. Deep tissue usually benefits and focuses on a specific problem. People who have chronic conditions, low back pain. I'm sorry that I'm yawning, but it's like 1:25 in the morning. I'm trying to get this done. Those are some of the benefits. Now I'm going to tell you, I lost my train of thought for a minute, who should get it or who gets it as far as deep tissue. You have people with these conditions that may ask or request or demand that they get a deep pressure, deep tissue massage. People who have low back pain is number 1 on the list, at least my list. People who have neck pain, that's number 2 on my list. And people who have limited mobility, people that are recovering from any type of injury such as whiplash or a fall, carpal tunnel syndrome, repetitive strain injury, and people who have postural problems, meaning they have problems with their posture. So anybody who have problems with their posture, meaning how they stand, their gait meaning how they walk. All that is, those 2 things are part of postural distortions. People who have muscle tension, that tension can be in the legs, the hamstrings, the glutes, the quadriceps, which is your front leg muscles next to your adductor muscles, your rhomboids, your upper back, and your IT band, iliotibial-costalial band. People who suffer with arthritis pain, another one is sciatica. People suffer from sciatica. Sports injuries, especially with runners and all athletes, can or should get deep tissue massage. Piriformis syndrome, tennis elbow, upper back and neck pain, and this last condition has been documented through research. Not too many men get this. It's called fibromyalgia. Fibromyalgia its origin is very unknown as of right now, but it's normally diagnosed with women, and these women who suffer from fibromyalgia pain is constantly in pain all the time. So I just described for you what is deep tissue, what are the benefits, who should get it. Now I'm going to go to the next video, and then I'm going to come back to the rest of how does it work and the precautions. So let me see if I can get this to move. All right. So on this picture, I want you to notice how deep the massage therapist's hands on these muscles. So let's take the first one. Here is your neck and lower head. Where the therapist's hands are, like from right here, is your suboccipital muscles. Right along in here is going to be your scalene muscles, your SCM, which is your sternocleidomastoid muscles. But Before the therapist can go this deep, the therapist had to do a lighter pressure massage first. Wait for those superficial muscles to release in order to get to the targeted layered deeper tissues that is on layer 2. Here we have the upper traps. Notice how the therapists have this muscles in between the thumbs and the first digits of the fingers. In order to do this, instead of just grabbing on it, that will cause more pain. So in order to do this, the therapist had to wait for these upper trap muscles to release in order to grab it like that and not cause any pain or discomfort to the person that is receiving this type of treatment. Now we have over here, take a look at this right here, right in there. Lower back and hips. Okay, lower back and hips is going to be, lower back is serratus posterior. Muscles in this area is also going to be the latissimus dorsi and the lower part of the trapezius muscles. But once again, take a look at the tissues and how the therapist is handling the tissues. Handling may be a wrong word, but manipulating these tissues. This one right here, the thighs and the upper legs, this therapist is using her other tools. Our other tools other than our hands, we can also use our forearm so that we can get deeper into the tissues. Now, these are the hamstrings this therapist is working on. I'm trying to see another good deep here. Here is, let me move this up if I can't. Oh, shoot. Okay. Here is back muscles. And notice in here how deep the therapist's finger is into the tissues. Look at this. This is what y'all asking us to do. And some of y'all don't even realize it. That we can go very deep to bone level deep. This is why I'm doing this, because a lot of you don't know what you are really asking us to do anytime you ask for a deep tissue massage. So let's go back up to this one. How does deep tissue work? It is used to break up any type of scar tissue and physically break down muscle knots, which we call trigger points, or adhesions, which are bands of painful rigid tissue. When the muscle tissue is like that, it can disrupt circulation and cause pain, also reduce your flexibility, reduce your limited range of motion, and sometimes it may be inflamed. So that's how deep tissue works, to break all that stuff up. But in order for deep tissue techniques to work, remember I said that the massage therapist must do a light pressure massage first, using Swedish massage strokes, different types of Swedish massage strokes to get the muscle tissue to release at the superficial layer before that massage therapist can go to the second layer, can go to the third layer, can go to the fourth layer, can go to the fifth layer, can go to the sixth layer, can go to the seventh layer, and at that point, the massage therapist is at bone level deep. So, next I'm going to I'm going to show you the next picture. Let me see if I can do this, because I don't want to scroll ahead. This picture. So with this picture, this is a picture of muscle. This is a picture of muscle, and I'm going to go over certain parts of this muscle tissue. I put this in here to give you an idea of what we're working with as massage therapists, because as massage therapists, when we do massage, at least me, I break the body up into muscles. You have 630 plus muscles. So anytime I'm doing a massage, and if it's going to be a medical massage, I am a medical massage therapist. So if it's going to be a medical massage, a therapeutic massage, or even a deep tissue, once I get the information from my client of what muscles are involved that I'm working on for a therapeutic or a specific health condition or a specific muscle condition, I visually and immediately break down that body into targeted muscles, where they at, how deep are they, and then I have to develop a treatment plan that's going to be very effective for my client so that they're not leaving in the same condition that they came in and saw me for. So I want to introduce you to a muscle. This is a diagram of a muscle. The credit is to this website or person at the bottom. I take no credit for this pic. However, I am going to take credit for the explanation that I'm going to give you. So here's the small picture of this big picture. So right here is what we call a muscle fiber. Okay, as you can see, it's striated. That's an anatomy lesson because there's things that are going on inside of here. So here is a muscle fiber. Outside of this is a fascicle. So this is a bundle of muscle fibers. Outside is called the fascicle. Outside of here, we have and I want you to see that this is pulled back and layered. So you have the epimysium, perimysium, endomysium, and in between, see if I can get this, right in here, right in here, right in here, anything that looks like this, you have your blood vessels. All in there is your blood vessels. So that's a general picture of muscles and muscle fiber. Going back to this, I know it's probably getting on your nerves that I keep going back and forth, but I have to go back and forth to give you an explanation of what I'm trying to convey as far as what ladies and gents be asking for as far as deep tissue. I'm going to discuss precautions for deep tissue massage. Now, for precautions, a lot of people are not aware that deep tissue, as massage therapists, we can hurt you with deep tissue. So that's another reason why I'm concerned and saying be careful what you ask for, because we definitely can cause you pain if the therapist does it incorrectly. And if you are in pain because of something that the therapist did, you as the client have the right, as soon as you start to feel uncomfortable, as soon as you start to feel pain, you have the right to tell that therapist, this is not for me, or lighten up on the pressure. And the therapist is supposed to adjust it. Adjust it. I have been in contact with clients that have came to see me, and they have given me a visual description of what has happened to them with other therapists that they received deep tissue from. Be careful, very, very careful of what you ask for when you're receiving any type of massage, but especially deep tissue. So I'm going to tell you what you can expect. As massage therapists, we are allowed to use our fingertips, meaning this is for deep tissue. We're allowed to use our fingertips, our knuckles, our hands, our elbows, our forearms during a deep tissue massage. Not right away. Like I said, we have to wait for the muscle layers to release before we can get to the next layer. And we have to keep doing that until we get to that targeted muscle layer that we need to be focused on for treatment. So I hope everybody can understand that part. Some therapists tell their clients to drink water after deep tissue massage or after every massage. Personally, I shouldn't even say this, but I'm going to say this without getting into trouble with the massage therapy state law. It is suggested that you drink water after a massage to help flush metabolic waste from the tissues. Now, I could have said that another way, but if I said that another way, I would have got in trouble, can get in trouble, according to state law. So to stay on the safe side, I'm going to repeat this again so no one misunderstand me. It is suggested that you drink water after the massage to help flush the metabolic waste from the tissues. No more am I going to say on that. Moving on to precautions and warnings. I'm going to tell you who it's not for. Deep tissue massage should not be performed on anybody who has blood clots. Anybody who has blood clots, anybody, let me give you an example, anybody who has thrombophlebitis or deep vein thrombosis, any type of blood clots, you should not be receiving deep tissue massage. Why? Because those blood clots can become dislodged. And if you have blood clots or you are at risk of forming blood clots, it is very important that you consult your doctor first. Personally, me, as a licensed massage therapist, blood clots is what we call contraindicated, which means you absolutely cannot receive a massage because you have blood clots, and those blood clots can become dislodged and can travel through your body. That may result in death. I don't want that on my hands. So, if you have blood clots, consult your primary care physician, your PCP, primary care physician first. But as a massage therapist, personally me, I wouldn't care if the doctor wrote the script and said it was okay, that you can receive it. In my professional advice, as a massage therapist, licensed, I will not service anyone with any type of massage that has blood clots. Not doing it. It's too risky. Next is anybody who has had recent surgery, chemotherapy, or any type of radiation or other medical procedure, once again, consult with your PCP, your primary care physician. And I'm going to add on another group of people. People who have osteoporosis should not get deep tissue massage. Period. If you have bruises, like you bumped into something or something happened and the therapist sees a bruise on your body, that therapist should not be massaging over that bruise. Or if you have any type of inflamed or infected skin, if you have any type of skin rashes, or you have an unhealed or open wounds, if you have tumors, any type of abdominal hernias, if you have fragile bones. Let's talk about fragile bones. Now, you have elderly people. Elderly people are very fragile. And sometimes, I don't know why, but sometimes you have elderly people who will come in and request a deep tissue massage, and you're looking at them like, why? Why? And for me, with the elderly, because they're so blessed and so fragile. With the elderly, I don't give them a deep tissue, nothing. Deep pressure, deep tissue, they don't get that from me because their tissues is very fragile. And some elderly people say, oh, I'm used to getting it. No, you should not be getting it because your tissues are fragile. Any massage therapist that doesn't listen to what the tissues of the body is telling them, they are doing you an injustice as a massage therapist. Because as massage therapists, we read what the body is telling us. We hear you. We listen to you. We listen to what you want. That's fine. But we also, as body workers, as service providers in the medical field, listen to what the body tissues are telling us that it needs. Massage therapists work with muscles, and we pay attention to what the muscles is telling us. Okay? And anybody who has had any recent fractures, now that one is just based on common sense. If you had a fracture, you know darn well you should not be receiving any type of deep tissue or deep pressure massage. Women that are pregnant, no, you should not be receiving a deep tissue or deep pressure massage at all. Now, let's talk about some possible side effects. Still talking about deep tissue, deep pressure massage. One of the number one side effects of deep tissue and deep pressure massage is it can result in you being bruised. So if you're easily bruised, it can definitely result in you being bruised up from the deep tissue, deep pressure massage. So that's something that you can expect. And moving on to the next picture. Excuse me. Now here is, and once again, I take no credit for these pictures. The credit goes to, down here at the bottom, is Central Anatomy. Here, and I think I have two more pics. I am showing you we're going to discuss layers. So if you think about it, I did promise that I was going to do a discussion on layers of muscle. I talked about it. I told you how many layers of muscle we had. So I want to just show you some pics that I found that gives a little bit of layers for what I want you to see, just to give you an idea of what it is I'm talking about. So we're going to talk about these muscles right here. These are your back muscles. In here, you have your erector group, your multi-fighter group, your rotator group, and all your back muscles. Up here is your neck muscles. In here, you have your suboccipitals that run across here. You have your scalenes that run across here. You have your supraspinatus here. You have your infraspinatus, and over here, you have your arm muscles, your deltoid. Now, if you take a look here, across here, and across here, and over here, you have your subscapularis muscles, and you have your deltoids, biceps, and stuff like that. So if you take a look at your supraspinatus here, that is a superficial muscle. But underneath that is your infraspinatus. So just here and two parts of your sits muscles, because there's actually 4. Here is your supraspinatus and your infraspinatus. These muscles are layered. So if I was working on these two muscles, and these two muscles was my targeted muscles, I would have to work on the outer layer first, which is your skin, soften those tissues up, work here on your supraspinatus, and remember, I showed y'all a description of the muscle layers. In case y'all forgot, here we go. This is what we're working with. Muscle fiber, fascicle, epimysium, perimysium, endomysium, blood vessels, and stuff like that. So now here I have to wait until your supraspinator muscles, from manipulation of the tissues, doing Swedish massage strokes, wait for this muscles to mesh. When we feel the mesh, that is called the release. That allows me to get here and work with your infraspinatus muscles. Just giving you an idea, that is layer 2. Moving on to the next one. Here we have another picture that is also layered that I wanted to share with you. So here we have the occipitals, we have the Galea ponderosa, and we have the sits muscles here and here, but I want to focus right in here. See all this? And this, and this, and this, and this. And of course, back muscles here and superficial back muscles here. So let's talk about what's outside and what's going in. So we're going to move out to go in. So you have your lat muscles. Well, you have all of your, remember I talked about your erectors, your multi-fighters, your rotators, and I discussed those muscles, didn't I? Right here. So these are the muscles that are deep. These that are outside is on top of those deep muscles that I just showed you, okay? So here you have your latissimus dorsi, and you can see what's cut off. Then you have your traps. Now your trap muscles is superficial, And on top of all these muscles is your trapezius muscles. Also, you should be able to see the SEM. Here is your SEM muscle. This SEM is called your sternocleidomastoid muscle. That muscle is very superficial, and as you can see, the attachment site is behind the bone of the ear. So I wanted to show you, and right in here, you have your scalenes, your anterior, middle, posterior scalene. You have your rhomboids back here. You have your middle traps. You have your latissimus dorsi. You have your rotators, your multifiders, your serratus posterior here. All those muscles. Now, when clients come and tell us they want deep tissue on their back, these are the muscles, all the muscles that I just named here without going into too much detail and confusing anybody. All these muscles must be manipulated, massaged with a Swedish massage technique until we feel a softness, a mesh, before we can get to the next level. So let me just try to give you a visual. Here is your outer layer of a muscle, right here. Outer layer, latissimus dorsi. Inner layer, the latissimus dorsi overlaps the trapezius muscle. Trapezius muscle is very long. So here's one level, one layer. Here's another layer. Then underneath that is another layer. And as you can see, the layers are here. This muscle here is underneath this muscle. In here, you have your occipitals, you have your suboccipital group, you have your rhomboids, you have your posterior scalene. You have all these beautiful muscles that are overlapped, and clients want us to go bone level deep. As you can see, these muscles are attached to bone. They are. Now, next pick. This pick, I am showing you the front muscles, the cervical muscles, meaning the neck muscles that we just looked at from the posterior side. Now we're going to look at them from the anterior side, from the front side. So as you can see, these muscles here are attached, but they're also overlapped. And I named these muscles in a previous picture. So what I want to do next, now that I gave you an explanation, I told you what deep tissue was, I told you what to expect, I let you know if it hurt, I gave you the warnings and precautions, I gave you the benefits, excuse me, of deep tissue massage. So, like I said before, all the credit for the pictures go to who I have credited at the bottom of the pictures. And I'm going to close this out with a thank you for watching this. Share this awareness video. Excuse me. It is an explanation on deep tissue massage, and my goal was to inform you, the public, on what it is that you're really asking for when you ask us to go deep. I'm not one of those massage therapists that's so quick to go deep. There's a lot of risks, some contraindications, some precautions, some warnings, and I went over that with you. People that receive deep tissue massage from me are either going to be robust or going to be athletic, or it's going to depend on what type of occupation they have, where their occupation is an indication for me to surface them with a deep tissue massage. Now, if you are a athletic person and you're a body worker, meaning you go to the gym on a regular because you beefing up, you muscling up, and you come to me and you say you want a deep tissue massage, I'm gonna tell you no. Because if you're not receiving massages on a regular basis and you walk in to my practice and say you want a deep tissue massage, I'm going to hurt you. And not saying I'm going to hurt you on purpose. You are going to be in pain from the massage because it was a deep tissue massage that you were given, and your tissues, your body tissues, is not accustomed to receiving a massage. So if you're the type of person who doesn't get massages on a regular basis, please don't walk in to any massage therapist. Well, you can. And with some massage therapists, they'll service you because they're looking at the money part, whereas I won't service you because I'm looking at the health part. So I hope that makes a big difference. Don't ask for a deep tissue massage. What I will suggest that you do is that you start off with a therapeutic massage. Get the massages on a regular basis to get the tissues accustomed to receiving massages before you decide, or your massage therapist decide, to go deep without causing any bruising or causing any harm. So that's what I have. Share the video. Thank you for taking the time out to listen. Thank you for taking the time out for watching my video. If you want to get in contact with me for additional information on what I have shared, or you want to schedule an appointment, you could call me at 267-864-8639. You could also follow me on Instagram at Philly Timeout Spa. You can watch my various YouTube videos that I have on my YouTube channel. You can go to YouTube, Google my name, Carolyn Hubert Black, and I'll come up and watch the videos. I have over, I think, like 100 videos that are informational videos for you, strictly made for you. Take a look at the videos, pick out which ones that you are looking for as far as information, general information, or information on a medical condition, or information on a health condition, or how massage can benefit you, because there's a lot of benefits to massage. Or you could follow me on my Facebook page under my name, or go to, no, I'm not going to say that. You can book an appointment. Book the appointment on my website at www.timeout-spa.com. You can book your appointment directly from my website. I will get a notice on my phone that you book your appointment. If you do that, just remember to arrive at your appointment 10 minutes early for client intake, so that you can be on the table at your requested time. So take care, everybody, and thank you for listening. And by all means, please share.